And I think to bring this all back to our original discussion, when these traumatic events occur, everybody focuses on the team that was affected, but not really on the manager who's trying to hold everybody together, or the person, like, who's checking on the manager, who is thinking about me as the team person who has to hold everybody together, or you, Wendy, or you, Kimberly, like, who really focuses on that person, because it's a tough load to carry.
There's many structures. There's so many layers when we talk about from directly impacted. There's still many layers out of that are impacted as well.
Yeah. Kimberly, to your work with the PPE project, what have you learned about the burden that healthcare leaders carry after traumatic events, or what have you, heard said that you think would be vital for people to know today?
Oof, that's a really good question. And it's so broad. The stories I've heard have been big. I think much of it is dealing with the own resistance or stigma around actually talking. It doesn't have to be to a mental health provider, but being able to communicate with somebody, being able to feel it's okay. It's healthcare is a profession of profession of perfection. There we go. It's the hero mentality. I can't be imperfect. I can't be human. And in many cases, you can't when you're dealing with safety and you're dealing with people's lives. There's a big burden there. And so finding spaces where it's okay to not be okay with peers and letting that be something, I think, is important. And especially for, the leaders. The leaders in these situations need to also know it's okay not to be okay. And that they have folks that they can talk to, building those support networks, building resilience programs, the things like Wendy does. I think those are invaluable for people at all levels. And I think that's what I've heard. So wishing people would speak to them. So the healthcare workers I have dealt with wanted folks to talk. They wanted somebody to acknowledge what they'd been to. Not it's just like, oh, great, you did it, great, now keep going, or fill out this paper. And they wanted that moment to go, that wasn't normal, or that wasn't what I expected, or that hit me differently. Yeah. And have that witnessed and validated.
Yeah, I think another thing that's important to note is that when these things happen, people are handling them that really were never trained to do that. Somebody said to me last week, well, yeah, you don't respond to this because you're a trained clinician and you're trained to not be surprised at this. And it kind of made me think about the folks who are in these roles where they are holding a team together and this unexpected event happened and they were never really trained to do anything like this.
Agreed.
Yeah, that's extremely common in the nursing world. I say all the time, we take the best bedside nurse and we make them a leader, and we don't give them any skills to lead people. And they may get like a budget class, but that might be it. So, it's been really important to us at Novant Health that we help leaders get that kind of training. So we're using stress first aid, but to give leaders that extra skill of how do I support people? Again, recognizing my own needs as well. So it starts there, like recognizing myself, but how do I support people? What does that look like? It's not just a list of resources, although that's part of it, but what does that actual support look like? And I think, we have to do better at training leaders to do that and to handle the emotional aspect that comes after, not just the event, but all the after that comes with it for themselves and for the team members. And I think we're starting to get there. I think we have a long way to go, but I do think it's getting better. I remember when I first became like a charge nurse, I just walked in one day and someone said, well, you're in charge today because you're the most senior person here. And I'm like, so I do think we're getting better, but we still have a long way to go with making sure that the training isn't just the logistics, isn't just the budgeting, isn't just the ERL system. It's more than that. It's the people skills too.
Yeah,